here. Okay, so that would be the end of the transverse sinus, and then coming down to the jugular foramen would be the sigmoid. But again, it has this, it looks straight instead of the double S. These are other sinuses up here that you guys don't have to know. All right. Then on the internal jugular vein is quite large. So it's going to be the large diameter vessel about the size of your forefinger, whereas external jugular is very thin. And remember I said its location is superficial to the sternocleidomastoid. So here would be the external jugular. Internal jugular is right here, but that's kind of a tight spot. I usually don't tag it there because it's hard to get the arrow into and visualize. But not only on the chart, but over here on the model, you can also see internal jugular, okay, and internal jugular. These two aren't showing the external jugular. The big fat one, the only one. So external jugular is very thin. Okay. Now, also on this model, you can see the facial vein with the facial artery, and that's going to drain into the internal jugular, and superficial temporal vein, seen with the superficial temporal artery, drains into the external jugular here. Okay. Now, you can also see superior sagittal sinus, straight sinus. What would this artery be? We have three cerebrals. Which one? Posterior is going to be back here with the cerebellum. Medial is going to be on the lateral surface of the brain. That leaves us with anterior cerebral that goes between and through the longitudinal fissure, up and over the corpus callosum. Okay? So,
Wait, can you repeat that?
I'm going to. Middle cerebral passes through the lateral sulcus and supplies the lateral view of form of frontal, parietal, and temporal lobe. So that's middle cerebral. And then posterior cerebral, seen here and here, does cerebellum and occipital lobe. And anterior cerebral passes through the longitudinal fissure and supplies the medial surface of the brain right over the corpus callosum. Okay? So again, on here, the area that my finger's covering would be middle cerebral, posterior cerebral, and anterior cerebral. Okay. All right, so as we move then down from the head and neck, the brachiocephalic veins are formed by the internal jugular and subclavian. They're often covering up the brachiocephalic trunk. You can see them on that chart. You can also see them right here. So here would be internal jugular and subclavian and brachiocephalic vein and brachiocephalic vein. And remember, those are the two veins that join together to form superior vena cava. Okay, so if we look at the heart, these two cut vessels right here would be superior vena cava. What other vessel drains into the superior vena cava? There we go here. That one doesn't show it, so we'll look at this one. Right here, draining into superior vena cava. So two brachiocephalic veins, and then this one draining into the superior vena cava also, coming from the left posterior chest wall, draining the, yes, azygos, good, draining the posterior intercostal veins. All right, so looking on the upper extremity, for our veins, we don't see veins on our muscle models. So to see the upper extremity veins, the chart and the wire models are best. So I'll look on our wire model first. And remember, we did the arteries on Wednesday. So we had our subclavian artery, axillary artery, brachial artery. Medial was ulnar and lateral radial. So now if we go back up to the heart and we start with our deep vessels, medial aspect, we're going to have the ulnar vein. join with the radial vein to form the brachial, then axillary, and then subclavian again. This would be the external jugular and internal jugular draining there. So the superficial veins are shown anterior. And again, we have on the medial aspect, basilic, which drains into axillary along with brachial. So this is brachial, this is basilic. They come together to form axillary. On the lateral aspect, we have cephalic, and it also drains into axillary just before it becomes subclavian. So this is our Y pattern. Here would be the median antebrachial, and this would be median cephalic and median basilic. So there is no median cubital when you have the Y pattern. All right? And that's why I told you about the Y pattern this morning in lecture, was because there's no median cubital there and everybody asks where it is. You don't have to be able to identify median basilic and median cephalic, but I'm just explaining that's why we don't have a median cubital. But we do have a median antebrachial. Okay? We have a couple of places that show the H pattern. So on our chart, which looks thoroughly confusing with all of our venous communicantes. So remember, the basilic is medial. So if we look on the little finger side, and we start tracing this vessel right here, it goes up here and empties into axillary. So this one is the basilic. On the thumb side, this would be cephalic. So notice you want to stay lateral. And so that's draining into axillary just prior to the subclavian. So here's basilic, here is cephalic, there's median cubital. That's the H pattern. All right? And this one draining is a little hard to follow along here, but that would be median antebrachial right there. Ulnar and radial are traveling with the arteries by the same name. We have another H pattern back here on this flat model. But it's confusing because you have to ignore one of the vessels that makes it look like a Y pattern. So on this arm, if you ignored that one right there, can you see the H pattern? So here would be cephalic, here would be basilic, and that would be the H pattern or median cubital. So that's our upper extremity, and then we look at the chest cavity, and we have the posterior intercostal and the azygos. So you can see azygos here. You can see azygos on the thin man chart, but not hemiazygos. So the best view to see that is here on the wire model again. So posterior view. This is, if you're looking at this would be left side again and right side on the posterior view. So draining the left side is hemiazygos, crossing over and emptying into azygos. And then this would be the accessory azygos on the left side as well. Okay? So the accessory hemiazygos. So hemiazygos crosses over behind the heart and drains into the azygos, which empties into superior vena cava. Now for the inferior vena cava itself, on the wire model, this is kind of compressed and tight. So there's other places that are better to see some of the branches that drain into the inferior vena cava. And you can see splenic vein coming from the spleen and inferior mesenteric, but for the rest of them, it's just tight enough in that region. So the better views to see those veins are on our charts as well. And most of the organ views are over on this side. So here's the portal system. Okay? They're red because the background is black, but it does have written in here veins to remind you that we're looking at the portal system. This is showing the major veins draining directly into the inferior vena cava, and even not all of them. All right, so here we would have the liver. And remember, when we look at the portal system, we have the hepatic artery and the hepatic portal vein both carrying blood into the liver, and that comes into the liver from the bottom, all right? blood flows through the liver and then comes out the top into the inferior vena cava via hepatic vein. So if you leave off the word portal and call it hepatic portal vein and hepatic vein, you don't get partial credit. Because you're talking about an entirely different set of veins, which are the hepatics. So this short segment right here is portal. It's formed by the vein draining the small intestine and the large intestine, which is superior mesenteric. That joins the splenic vein and forms the portal vein. Inferior mesenteric, coming from the descending colon, comes over and drains into spleen. That blood then flows through the liver and out the liver via our hepatic veins directly into the inferior vena cava. Now this is showing the hepatic veins cut here, where they were coming out of the liver into inferior vena cava. This model also shows that if you have a confusion about what the hepatic veins are. So from the inferior aspect of the liver, you can see the larger portal vein, which is purple, and the hepatic artery, which is red. And again, those are both flowing into the liver, flows by our liver cells, and then up here you can see several hepatic veins going into the inferior vena cava. So if they're leaving the liver and going into the inferior vena cava, they're hepatic veins. If they're going into the liver with the hepatic artery, it's the portal vein.
Can we just call it portal?
Yes. All right, then over here, there's a couple of locations. We don't have the gonadal veins on our model. We have gonadal arteries. But here you can see the right gonadal vein draining into the inferior vena cava, and the left gonadal vein going into the left renal vein. Okay, and also on the blue chart over there, the stand-up chart on the lower diagrams are the various branches that go into the inferior vena cava that aren't a part of the portal system. Then another view of the organs of the portal system come off of this large stomach model. And remember, I suggested this one for the celiac trunk. So if you know the arteries of the celiac trunk, the portal system veins travel with their components. So here would be the celiac trunk. And remember, there's 3 branches to the celiac trunk. So we have the left gastric artery. Going to the left side, we have the splenic artery. And going to the liver to the right side, we have the hepatic artery. Okay. Coming off the aorta, below that, and behind the stomach, and from underneath, we have the superior mesenteric artery. Now, traveling with the superior mesenteric artery, we have the superior mesenteric vein. And we can see that coming up here. This would be the superior mesenteric vein. Okay. Then coming from the left side, from the spleen, this would be our splenic artery. Coming from the spleen, we would have our splenic vein. And the two come together to form the portal vein. So we have that same combination again, hepatic artery and portal vein. Okay. The inferior mesenteric vein is shown draining into splenic vein. Why don't we see the inferior mesenteric artery with the inferior mesenteric vein? It's coming off the aorta much farther down. Okay? So we see it coming up, but we don't see the inferior mesenteric artery because our aorta just isn't long enough. But please feel comfortable with the concept of the hepatic artery and the portal vein together, because they're both carrying blood into the liver. All right, looking at the lower extremity, again back to our wire model. So remember, for the arteries, we had the external iliac forming the femoral artery. That passed through the adductor magnus muscle and became the popliteal artery on the posterior aspect. That divided into anterior tibial artery and posterior tibial artery. And the lateral branch of the posterior tibial artery is the fibular artery. So if we move over now to the venous system, here's the lateral branch, which is the fibular vein. It's going to drain into the posterior tibial vein. The anterior tibial vein joins the posterior tibial vein to form the popliteal vein. And in lecture this morning, we talked about the small superficial vein that drains into popliteal, which is the small saphenous. And then we have our large superficial, the longest vein in the body, which is the great saphenous. So over here on the chart, you can see the small and great saphenous. This is a medial view. So this vessel right here, just under the skin, is the small saphenous. Traveling from the medial side of the foot all the way up here is the great saphenous. And you can also see the small saphenous from this posterior view draining into the back of the knee. Now I didn't mention it in lecture, but the way I remember, when you look at the small saphenous on charts, it always shows it lateral. And it does start lateral from the lateral ankle. It doesn't come from the foot, but from the lateral ankle. But then it moves midline, right up the back of the calf, as I showed you there. And one of the best ways of illustrating that is that I've been able to come up with is back in World War II, before I was born, women were wearing silk stockings, okay, made out of real silk, and they were sewn together, so there was a seam. And you didn't go out in public without making sure that your seam was straight. And that seam ran up the back of the calf. Well, during the war, they didn't have silk because that was taken for parachutes. They didn't have nylon yet. And so women that wanted to dress up and didn't have stockings would pretend by drawing on each other a thin black line up the back of their calf to represent that seam. So if you were to draw that thin black line on the back of your calf, and then if you were to cut your skin open, you'd find a small saphenous in the same place, just about a quarter of an inch to half an inch below the skin, depending on how much adipose tissue you had there. All right? So while it looks lateral, in many of our diagrams, it's actually midline, so that it gets from the ankle. Okay, now let's look at fetal circulation. So this is the chart that was in the back of the room. It's the only chart or model that we have for fetal circulation. This larger portion here is showing the mother and giving rise to the blood to the placenta, and this is the fetus. All right. So let me just move these over so we can see. So here would be what I covered in lecture. We would have leaving the fetal heart, going through the abdominal aorta, into the common iliacs, into the internal iliacs, and off of branches of those, we would have the two umbilical arteries. Okay. They are carrying deoxygenated blood. And as you can see on the board, of all the 5 fetal structures, they're the only ones to carry deoxygenated blood. Everything else is carrying oxygenated. A single umbilical vein comes back from the placenta through the umbilicus, goes up to the liver. Some of that blood will go into the liver tissue because it's rich in nutrients. Most of it will bypass the liver and go into the inferior vena cava. That bypass structure is the ductus venosus. When it gets to the inferior vena cava, it comes at an angle that most of it is shunted directly through the foramen ovale to the left side of the heart and out the aorta. However, some will go into the right side of the heart, out the pulmonary trunk, where again, some of it will be shunted from pulmonary artery to aorta via the ductus arteriosus. Okay? Now in lecture and lab, we've already talked about 2 of the adult structures. Foramen ovale being the fossa ovalis, and ductus arteriosus being ligamentum arteriosum. So on this view over here, the 2 umbilical arteries are collapsed and no longer are open when the umbilical cord is cut, and so they become the medial umbilical ligament. All right, not median, but medial. And there should be an anterior abdominal wall somewhere. There we go. So this is supposed to represent the anterior abdominal and anterior chest wall. All right. Here's the umbilicus. So when we turn it around, we can see 3 structures coming up. This represents the urinary bladder was open through the urachus, and then on either that's the median structure, okay, medial are these two structures on either side, and you still have those on the inside of your anterior abdominal wall. They're the collapsed umbilical arteries that you used when you were a fetus. So these represent the two medial umbilical ligaments, right, going to your umbilicus. Then, the umbilical vein, remember, is going from your umbilicus to your liver. So on the inside of your anterior abdominal wall, and it's not shown in that model, but I can show you on this large liver here, it's going into the liver. This is way bigger. I would have some kind of hepatic disease if my liver was this large. All right? But on the deep surface of the liver, you can see portal vein and hepatic artery. Going into the liver, we have the umbilical vein. So in the adult, that collapsed structure right here is ligamentum teres. Okay? So we see those same three structures: portal vein, hepatic artery, and what would have been the umbilical vein in the fetus, and then the adult now is ligamentum teres. Okay? Then the blood goes through the liver and goes out the liver via hepatic veins, and in the fetus, the ductus venosus. So this is the collapsed ductus venosus going into the inferior vena cava, or ligamentum venosa. So those are the new materials. Alrighty. So again, on Wednesday, we have a quiz over all of this. Feels like half an exam material, and it's more than that as far as numbers of things. Arteries, veins, and renal circulation. So because of the amount of material, there'll be 7 questions on the quiz. So you can miss 2 and still get 10 points. Okay? That way I don't feel like I'm coming to cut something out and not ask you something that I know you studied. All right, feel free to take the models back to your tables if you wish, or we'll get them over here.